in.
Performing hygiene. Hello, my name is JJ Johnson. I'm going to be your nurse for today. Can you please spell your first and last name and give me your date of birth? Just gonna check
Date of birth is 10/13/2003. My name is Jua'Queyunis Johnson. JUA''KEEMIYAH. Last name JOHNSON.
Alright, thank you so much. Before we start, do you have any allergies to any foods, any medication, anything I should know about? Alright, do you know where you are?
At the doctor's office for my checkup.
Okay, and do you know what today's date is?
Yes, it is September the 15th, 2024.
And what day of the week?
Sunday.
Alright, perfect. Okay, and I'm just gonna be doing a head-to-toe assessment today for you. And just gonna start off with some vital signs, okay?
Okay.
Alright, you're sitting at 120/80, so your blood pressure is perfect. Now I'm just gonna check your pulse. Let me see your wrist is. Alright, your pulse is 72, and it's between the range of 60 and 100, so you have a good pulse. Your respirations are sitting at about 18, and the range is 12 to 20, so you know you're good there. May I see your feeling? I now have to take your O2 saturation, and it is 95%, so you're in good range for that. Alright, are you in any pain today? Okay, that's good. But if you were in pain, then we'd have to use old carts to further assess the pain. I'm assessing your demeanor and everything. I don't see any signs of any distress. Patient looks normal all the way around. And now I'm just going to be assessing your hair, skin, and nails. So first I'm going to, could you please remove the bonnet? Thank you so much. First I'm just going to assess even, no abnormalities. Okay, patient has nails on, but check toenails, everything looks as it should. I don't see any abnormalities so far. And now I'm just going to palpate the area. Okay. Don't feel any lumps, any lacerations. There's symmetry on both sides. Skin. I'm gonna check for turgor, elasticity. Okay. Alright. And everything looks normal with her hair, skin, and nails. Next, I'm gonna check your head, ears, eyes, nose, and throat. I'm just gonna look you over. Everything looks normal with her head. I'm just assessing right now. And then I'm gonna use Perla to assess the eyes, which is pupils equal reactive to light accommodation, basically meaning that whatever one pupil does, the other pupil should do as well. Okay. Her pupils look normal. They're both reacting the same way to the light. And next, I'm just going to palpate the area. I'm not feeling any abnormalities, lesions. Feel the throat area, lymph nodes. I'm gonna feel her ears for any lumps, any abnormalities. I also have to check inside the ears. Some cerumen should be normal. She has a normal amount, which is protective of the eardrum. So everything looks good there. Also, could you smile for me, please? Oh, with teeth. Yeah. I'm going to check her dentition, check her teeth. Could you open your mouth? Her tonsils look normal. The color inside is normal. No lesions, no lacerations. Alright. Now, it's time to check respiratory. Have you had any cough lately? Any issues breathing? Anything like that? Alright, I'm just going to listen. Could you take some deep breaths for me? sound the same. So, and she sounds clear on all 8 sections of her back. And you never need any supplemental oxygen, anything. Okay. And I'm just gonna listen to your heart. And can you lean forward slightly? Okay. First, I'm going to listen to the apical pulse. Everything sounds normal there. And then I'm going to listen to the pulmonic. And then I'm going to listen to the Erb's pulse. Everything sounds good. Then I'm going to listen to the tricuspid. And then to the mitral. Okay. And your heart sounds good. You have nails on right now, so I can't check your nails for capillary refill. So I'm just gonna check your toes, because it should happen here as well. Okay. And the blood comes back to the area within 3 seconds, so your capillary refill is good. Next, could I have you plug in? A little more privacy. So, how are her bowel movements normal? Your urination? No abnormalities? No problems with that? Okay. I'm just going to check your GU and GI. Okay. Alright. Provide some more privacy. Okay. And when checking the 4 quadrants of the abdomen, I'm first going to inspect. Alright. And then I'm first going to auscultate, because I don't want to put pressure on the region to potentially affect the sounds that I'm going to hear. So I'm just going to listen first to each quadrant. Just going to listen to quadrant 1. 2. 3. 4. Okay. You should listen to each of those for around 1 minute. And then now I am just going to palpate lightly in each region. Let me know if there's any pain. Is there any pain here? Any pain here? 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 And then I'm just going to press a little deeper. Feel for any lumps, any differences between the quadrants. Make sure there's symmetry, everything's flat, nothing's bulging. Okay, everything looks good there. And then if a patient does have a catheter, you only expose what you need for the exam. So, pull this down, check the site. Okay, everything looks good. We're gonna check the tubing of the catheter. make sure that the catheter, well, the bag where the urine is being collected is sitting below where the site is. And then we're gonna check the bag for odor, for color, for consistency. Everything looks normal there, so she's good as far as GU, GI. Okay. Sorry. I'm gonna pretend that I let your bed up earlier. So I'm just gonna let your bed back down. And then could you sit back up for me? And now I'm just checking the extremities for any numbness or tingling. And I'm also going to be checking for range of motion in this part of the exam as well. So, arms, other arm. Can you squeeze my fingers? Okay, good. Push up. Push down. Alright. Push up. That's one. Bring the legs back. Alright. So, is there any numbness, any tingling? Alright. She has good range of motion in all of her extremities. She doesn't feel any numbness, any tingling. And again, her capillary refill in her toes was good. Let me check. Okay. Are you comfortable? Do you need anything? Okay, this completes your physical assessment. Here's your call light. Don't be afraid to reach out to me if you need anything. Thank you for your time.
Thank you.
Stay.
You too.